The following educational video was created in collaboration with the Faculty of Biomedical Engineering of the Czech Technical University in Prague and the First Surgical Clinic of the General University Hospital. The sterile table is primarily prepared for assisting with minor surgical procedures such as wound suturing, cutting out skin moles, incision and ablation. It is also used for extensive wound dressing changes, securing central venous and arterial accesses, puncturing cavities, and, last but not least, for surgical procedures in operating rooms, serving as an instrument table. In practice, several methods are used to prepare a sterile table. The choice of method depends on the specific department and procedure for which the sterile table is being prepared. The table is prepared immediately before the procedure in a calm environment with sufficient workspace. This minimizes the risk of contamination and material sterilization failure. Dispensing method. Start by cleaning the top surface mechanically, then we use a disinfectant for surface disinfection. Disinfect by wiping or spraying. Put on protective work clothing. The use of personal protective workwear follows the standards of individual workplaces. Before preparation, perform a hygienic hand disinfection and prepare the necessary tools. A mobile stainless steel table for invasive tasks, a stainless steel mobile table for invasive procedures, a dressing trolley, and the materials required for the specific procedure are needed. Dispensing method with disposable sterile towels. Sterile towels are picked up with sterile forceps and spread out on the instrument table. Do not touch the drapes with our hands. Work aseptically. Place the towel towards you, covering the table edges by at least 2.5 centimeters. Return supplies to the table from the middle. Place the instruments on the table according to the specified surgical procedure and other tools needed for the operation. Unpack disposable items carefully by opening the package along the seam, never by tearing. Cover the prepared table with a sterile towel to prevent contamination of the tools. Place the towel with the side facing away from you to prevent unintentional contamination of the prepared tools by the worker's clothing. Preparation of pre-packaged sterile sets for invasive procedures. Complete sterile packs for minor surgical procedures include gauze material, sterile towel, and instruments according to the procedure they are designed for. These can simply be unpacked, spread out, and used. Gauze tampons should be soaked with disinfectant from a sufficient height. If a flushing solution is used, a transfer spike should be used. The third, older and less commonly used method for preparing a sterile table involves cloth towels. First layer is always waterproof. On top of this layer, place cloth towels. After use, they are washed and subsequently sterilized. Additional instruments are prepared similarly based on the procedure's requirements. After the procedure, we clean the tools and decontaminate the instruments. Sharp waste is disposed of directly into a thick-walled barrel for infectious waste. Throw disposables in the infectious waste bin. Other tools that do not need to be sterile are prepared on the dressing trolley or on the lower shelf of the sterile table. Mashi. No dispensing method. This method is most commonly used in operating room areas when preparing instrument and auxiliary tables for surgical procedures. The table is prepared while wearing sterile gloves and a sterile gown. The mouth is covered with a mask and the hair is covered with a cap. The circulating operating nurse hands over materials and assists the instrument technician in preparing sterile instruments and materials needed for a specific operation. Summary. Before handling materials, perform hygienic hand disinfection. We will put on protective workwear. Mask, cap, empire according to the standard. Disinfecting the surface of the table with spray or by wiping it down. First layer of the sterile mask. Place it towards the body, with the waterproof layer facing down. The towel covers the table edges by at least 2.5 cm. Place materials, instruments and consumables from a sufficient height to avoid contaminating them. Syringes, needles, sutures and other supplies should be removed from the packaging by opening the seam, never by tearing the package. We use tongs for dispensing, which are also called dispensers, or using sterile gloves. On the lower surface of the table, prepare non-sterile tools needed to assist during the procedure. If the procedure does not occur immediately, we cover the prepared table with a towel facing away from us, from front to back. Sharp waste is disposed of directly into a thick-walled barrel for infectious waste. Disposable tools are discarded in the infectious waste bin.